everyone. Thanks so much for joining us today. My name is Lydia Ramsey Pflanzer, and I'm a healthcare editor at Business Insider. Now, I think we'd all be kidding ourselves if we said we'd baked a global pandemic into our 5-year plans. Least of all, I'm sure, our healthcare startup co-founders who had to navigate remote employees starting in the early months of the pandemic, addressing healthcare concerns head on in a pandemic that made many frontline workers and required new levels of protective measures. Then, of course, there's the small matter of building a growing and sustainable young company and raising money in the age of Zoom to do that. It's certainly no easy task to pandemic-proof your startup. Joining me to share how they're doing it now that we're 7 months in, we've got Chirag Kulkarni, who's co-founder and CMO at Medly Pharmacy, Matt McCambridge, co-founder and CEO at Eden Health, and Florian Otto, co-founder and CEO at Cedar. So let's dive right in. Obviously, it's no easy feat to be leading an organization through a period like this. One of the questions I like to ask folks to get a sense of where they're at mentally these days is, what's keeping you up at night? That is, what's the most overwhelming part of this situation as it exists right now? Matt, let's start with you.
I think that a couple things. First off, just the things that are going on in the world, as you don't operate in a silo. And I think especially in healthcare, you definitely don't operate in a silo, whether it's politically or with the pandemic going on. There's just a lot to process. So that's definitely one piece. The second thing is we're actually on the front lines delivering medical services. So we have doctors, physicians, physician assistants, nurse practitioners, care navigators, physical therapists, behavioral health providers. And so they're really on the front lines of providing care. And we've seen a lot of growth. So my next biggest thing after what's going on in the world is we got to keep hiring people, and we got to hire people even faster. So those are my two things that keep me up at night, although I try to get good sleep, so I make good decisions.
Good call. Good call. Florian, how about you?
Very good question. And I definitely share that with Matt, what you said. But maybe on top of that, I think one of the, besides, of course, keeping the company healthy, that's the number one goal. Absolutely. Keeping people motivated, taking care of also the mental health and engagement of team members. Maybe the one thing that I think stands out right now in this time is, in a startup, you can never really plan for the next 5 years. It just makes no sense because things change too fast. But in these times, it's actually even more important to stay flexible and to stay nimble and to balance that with desires of team member, also to have some planning is actually pretty difficult, I think. So you would love to just basically live day by day, but it's not possible because a lot of people need to plan. A lot of things take a bit of time, especially in product management. So balancing that is difficult.
For sure. Chirag, how about you? What's keeping you up these days?
Yeah, no, I mean, echoing what, both Florian and Matt said, I think, when the pandemic hit, we immediately kind of went to the team and almost rallied around the mission further as kind of, a business that is in the thick of it, especially with the pandemic. Obviously, our business has become more and more relevant because of it. But I think first and foremost, just making sure that the team members are safe and happy and healthy, right, throughout this process, and just making sure that the measures are in place to do so. And to Matt's point, we've grown substantially, not just in terms of headcount, but also in locations and sizes to match kind of the demand for our services. So just managing the growth, right? From not just hiring, but obviously we announced a fundraising round. So there's a lot of exciting stuff that has happened throughout the process, but obviously still staying vigilant about what's happening in the world.
For sure. Now, a common thread I was hearing from all of you is, the importance of yourselves in your leadership roles, managing employees. It sounds like this is a big part of any leader's day job at this point, is figuring out, how do I engage? How do I recruit? How do I do this? Chirag, to your point, you've grown a lot as a pharmacy. You've expanded to a number of different geographic locations, let alone just probably expanding here in the city. How have you guys navigated that? Are you stopping by the pharmacies as part of your day-to-day?
Yeah, I mean, I think what we think about is, what's a scalable way for us to ensure that people are staying happy and healthy? And what we've done, I think, from the get-go is relying on really the senior leadership teams to strategize with their respective managers and team members around what's going to work best for their org. Obviously for us, we have obviously a big function of our business is within the pharmacies. So a large portion of our headcount is the ops function, where you're coming in encounters with team members on a daily basis. So what are ways that we can, communicate effectively on the ops level, but also like with organizations or departments such as marketing, technology, those are distributed. So we've kind of allowed the senior leadership to decide what works best. And I think the key really is just implementing these protocols within the pharmacies itself to make sure that, again, people are staying healthy and the health is really at the foremost, but we're also able to serve our customers during this challenging time. So that's how we've tackled it mainly.
For sure. Yeah, it's definitely tough. Matt, you've got in-person offices for your, primary care services and things like that, but also a big virtual presence as well. Did you have to close any of your in-person offices down in those early days, or I guess, how are you navigating, keeping everyone healthy and safe all at the same time?
Yeah. So not only have we been doing this really for ourselves and our own employees, but we also do it for all the employers that we partner with. So we've been sort of in the thick of planning around how do you maintain people at the office throughout the pandemic for ourselves and for others. I mean, we're blessed with having fantastic clinicians. That is like the number one thing I think that our patients and customers realize when they interact with them. So in many ways, it's been in their hands to make sure that they're following all of our protocols, keeping themselves safe. But they've also been really selfless. I mean, early on, if we think back, way back to March in New York City, when it was, I don't know, like the 12th or the 14th, that everyone kind of realized collectively at the same time what was actually upon us. That was a really uncertain time. And so we really knew that we needed to keep the medical offices open for our members. And so we've never closed fully our medical offices throughout the pandemic. And I think in many ways, you see obviously the value of virtual care. There's a lot of virtual care companies have received a lot of funding, but I think the pandemic has also showed the critical importance of physical care, whether it's getting a test, which is still far too hard to get for most people around the country, or just dealing with the normal healthcare items that would come up in a year. Having that access to physical care is important. So we've been in a slightly different position by employing clinicians, right, who are experienced with infectious disease. But at the same time, we've sort of gone about this alongside partnering with our employer groups and helping advise them about how to stay safe, but also importantly, stay open.
For sure. Florian, what kind of challenges are you facing, with Cedar and growing your company, in trying to build a company culture? Have you found a good way to replicate a good old-fashioned office happy hour?
That's a good question. I mean, happy hours we do all the time. I mean, we had a lot of things already going on. We had animal drop-ins for lunch from the zoo, where we had a live streaming from the zoo to explain something on the animals. We had wine tasting. We have happy hours. We have a lot of things. I still believe that that human interaction, seeing somebody in person, is a different level. So I might be a bit conservative there, but I just really enjoy having a human being in front of me. So maybe I think there are a few things, of course, we needed to change in terms of modus operandi, where literally in the past we have, I don't know, visited clients for commercial conversations or for implementation. Right now, everything is remote, which I actually think is a net positive thing, because we somehow get used to do something remote, and also we can keep some of these things up when the country opens again. I think that's the net positive. Where, of course, for us, where everybody is remote and just very few people are in the office, what is the most important is that is to really keep the differentiator of what makes Cedar very attractive to top candidates. And I think if companies stay right now remote for very, very long, it's much tougher to explain to candidates what is the special thing on Cedar. They might just want to join Google or Facebook because they can work from anywhere anyway, and they probably pay more. So I think it is extremely important to really double down on that. And that's probably one of the things where I'm right now not too worried yet. But if this right now goes for a very long time, I think we need to focus on that.
Yeah, that's a really interesting point of, if you aren't it's hard to, sell someone on this particular company, without being able to be in person and see everything. Are Matt and Chirag, are you guys experiencing that as well when trying to recruit?
I think from us, right, and I really like what Florian said, right, which is how do you drive home, in Cedar's case, how do you drive home the differentiator, right? And I think for us, whether it was our first employee or now to our 550th, almost 600th employee, it's always really been about what mission are we driving, right? Whether you're in person or you're virtual, the mission is the same. Whether you're a care coordinator, you're working on the sales side, or working in marketing, like our mission was to make prescriptions easier when we started the business, and it still is. And I think really being able to drive that home, I think culture is a big function of that, right? And it is very little to do. And I think obviously now it's becoming more emphasized around, whether you have a chef at Google or you don't, right? At a lot of our startups, we don't have those kind of luxuries, but I think it's kind of allowing candidates to really see the essence of why companies exist and how true their entire, employee base is to that mission. So I haven't seen us have a huge issue with doing that. Obviously, there is a familiarity portion of meeting in person and doing so, but I think across the org, that's just what we have to live with for the time being is just relying on Zoom and being able to connect at a human level.
Yeah, I mean, on our end, just to echo the mission point, we've been really very focused on being super clear about our mission, which is to create a world where every person has a relationship with a trusted healthcare provider. And that piece, I think, really comes out to candidates. And we've often seen, we've been recruiting people pre-COVID, but, we're tripling the organization in size this year. And so we've been doing a lot of recruiting throughout. I think that's really resonant with people. And then we have a very strong emphasis on our values as well. And those come out in the interview process in every conversation, and we bring it up all the time as an organization. So that seems to me to be the biggest connection point. I think it's an opportunity with healthcare as well. I mean, this is the only thing that people are talking about by and large, this and some and a variety of Netflix shows and then definitely the election. But this is one of the biggest things that's going on. And so having something that is people are so connected to in the moment, I think there's a huge opportunity to really connect that mission. The last thing I'll say on it is just being honest about what your mission really is. You cannot sell candidates on a mission and then turns out you actually don't really feel that way, at all, which we've recruited candidates from companies who really felt like that was dissonant. I just think, for people who are building organizations at this time, be honest with yourself what your mission is. And if you do believe that this mission, it's impactful, connected to the moment, I think you'll find a lot of success recruiting. It's just not going to be possible from Google or Facebook to really have that in the same way.
For sure. Yeah, and I want to talk a little bit more about, to your point, healthcare is one of the biggest conversations I have with anybody. The number of times I've, gotten asked, when am I going to get a vaccine, Lydia? I wish I had a nickel, but every time. But so let's talk a little bit more about that. This is definitely a really interesting time to be navigating the world as a healthcare company. Chirag, in the early days, it seemed like everything was going online. I definitely had a 2-week period where I wouldn't step foot anywhere but my apartment or taking my dog for a walk. But since then, I've totally relaxed. I'm popping into my local pharmacy to pick up a flu shot or, Halloween candy. I'm curious if you've seen that kind of reflected in Medly scripts. I think we talked early on in the pandemic and it sounded like script volumes were going really, really high, but, have you seen any drop off in growth or in people reverting? Would love to get a sense of that.
Yeah, absolutely. I think there's a couple of trends in terms of the medications that we're noticing. I think one, doctors kind of shifting from their physical locations into telemedicine has been a big, just in general shift. And the types of medications I think that we're noticing there are also kind of varying too. So I think that's one big thing. Number two, I think just because of the growth that we've had prior to the pandemic and just in nature of the success that we've had in kind of delighting the customer, I've noticed a lot of customers telling their friends and family members about Medly, and naturally the behavior of physicians to their patients is ongoing, although that has decreased to a degree because patients are not going to the doctor as much. But we are noticing a lot of inbound interest in Medly through word of mouth, which has been a really big driver for us. And then number three is kind of this relationship with these other stakeholders, right? So, we talked really early on about our relationship with a couple of insurers, one being Emblem Health. So, working with a large insurer like Emblem Health and trusting really their members with Medly to deliver their medications is another big trend. So some of these like partnerships at the grassroots level, I think is a big trend that we're noticing as well.
Mm-hmm. Yeah, it's really interesting. Does it make your job easier as chief marketing officer that so much is happening by word of mouth?
That's a good question. I think it's different challenges than maybe before, but the reality is that all of this is fitting in with, I think, the behaviors that we're noticing. One of the things that we had spoken about early on in the pandemic was kind of the nature of our business, where once a patient uses Medly, generally they don't want to go back to their old pharmacy or their old experience. So that's really benefited us because you have a lot of patients who are now trying you for the first time through word of mouth. They're hearing about Medly, they're trying it, and they're having a great experience. And generally speaking, they'll stick on from there, right? If they have medications. And of course, if the therapy ends, right? And that's the nature of the business. So I think from that standpoint, it's working. I think managing these stakeholders and being able to scale the team and manage the growth, that has its own set of challenges or unique challenges to, before the pandemic. So you pick your battles, I would say.
Fair enough. Matt, you've talked about this a little bit, but Eden's business, you're really tied to employers, and many of whom aren't having a lot of their employees back in the office. I know I haven't been back since March. I think probably, Matt, the last day I was in the office was the day I met up with you and was like pouring over everything. It feels like a lifetime ago. But I guess how does that change your relationship with employers? What kind of questions are they asking you for help on these days? And can you walk us through that a little bit?
Yeah, so we've actually been delivering services to keep people being able to work out of the office for longer than we think any other company in the US. So we launched with a client the last week in March with a comprehensive program around screening, other testing protocols, and tracking and tracing basically at the office, and then have been doing that for a long time. So we've had about 100,000 screened employees during kind of our time in terms of just people back in the office physically. So the thing I also talk to people about, especially outside of the tech world, is I think that there's a set of companies in technology that it's really well suited to be remote, but it's very rare for that to be the case for most organizations. You've got security staff on site, you have essential operations, we've got manufacturing companies who have locations, and tech companies might think about like Rent the Runway, which is a customer of ours. They've got the tech side, but they've also got manufacturing sites, right, that are basically dealing with the clothes and whatnot. So I do think that there's just the dichotomy of saying, oh, everyone's fully virtual is just not fully accurate. So it's basically what we've seen is, this is really the first time where you have CEOs and executives at companies waking up every day and wondering if their employees healthy enough to work or healthy enough to buy, or customers are healthy enough to buy. So it's this dynamic of health is such at a high level in the organization and permeates really every decision. So I think what we've seen is companies now thinking about healthcare as something, oh, you kind of have to do this, but the experience doesn't matter as much, to saying, this is fundamentally business essential, that if we don't do something about our health of our own employees, we are not going to operate anymore. And so that has really changed the dynamic. I can't really say, think of the thing that companies haven't asked us about with regard to the pandemic. So, whether it's cleaning protocols, how to sequence people back into the office, or, trying to forecast when vaccines are going to come and everything like that. It's kind of been everything. So definitely a lot of in-person, but it runs the gamut.
I had someone early on kind of explain their newfound role, like some healthcare company that worked with employers, as like the company's CMO or chief medical officer. It's got to be tough to field all those questions. Have you, thinking about, that Rent the Runway example, has that made you rethink how either you position Eden or how you guys operate, like thinking about these different groups of employees and thinking about that? Does it fundamentally require a different way of thinking about the model?
I think that, to Chirag's point earlier, in many ways, it's advanced the same themes, right, that were already happening. I think it's one thing that's different about healthcare in the pandemic versus, maybe an e-commerce business in the pandemic is like, it's unclear for e-commerce the extent to which is going to stay, right, afterwards. For healthcare, you basically have these themes that were happening, right? Like, we knew things were going virtual. We knew you were going to get prescriptions delivered to your home. You had employers that were trying to engage more deeply around health and wellness because that was so valuable, bringing mental health to the workforce. So what we're seeing is an acceleration around existing sort of themes. And so I think you're going to see stuff sticking around much longer in a post-pandemic in a way that is kind of different from other industries. So, I mean, that's kind of playing out in us, where you're seeing the questions around health and wellness and mental health of the employee population having more operational it's more essential to the operations of the business. And so you're not just talking with the human resources or people teams, you're talking to the security teams, you're talking to the chief operating officers, you're having conversations with the CEOs. And I think that's been a big change, just who are the people who are really involved and what parts health touch in terms of the operations of the business. Definitely.
Yeah, that's really interesting. Florian, how's business been for you guys as Cedar? What are health systems asking you for at a moment like this?
Yeah, good question. And I think I share 100% what Matt said as well, that these trends that already existed before just get accelerated. And of course, I mean, all three of our companies, we are on the right side of the equation. So I think although there's a lot of disruption in the short term, I think in the long run, it will actually just accelerate the adoption. So overall, I mean, in healthcare, and especially healthcare technology, one of the biggest problems is always adoption. And right now, healthcare providers, when you do business with them, they're actually forced to adopt. So they are having plans in the past to, 5 years telemedicine rollout. Right now, they need to do that in 5 days. And they were actually able to do that. I think that is the most amazing thing. So healthcare providers really saw, okay, what are they capable of doing? I think that's fascinating. So I'm pretty sure that they remain with that muscle. There's, of course, one big thing that literally changed is that healthcare providers right now are under immense financial pressure. It's literally, I mean, when you deal with health insurance companies, yes, they have a huge windfall in cash. They're basically even afraid of posting all these gains probably this year. So they don't really want to do that. But healthcare providers, they have a big problem right now because of all of the elective surgery. So if you right now do business with them and you ask for a high capex in the beginning, there's no chance this will get adoption. If you have something where the ROI is very clear, they're actually almost faster in adopting that. So Cedar's value proposition plays in pretty nicely actually in that, because we are improving the healthcare experience for the patients, which is very important in these times, making everything digital. So no check-in forms, no dirty iPads when you need to sign in. And then of course, sending physical statements in times where people don't really have an apartment sometimes anymore doesn't make any sense. So shifting that to digital is of course great. And if it reduces the bad debts, so increases the yield, that of course is fantastic and is a good value proposition for them. So overall, I mean, for us in the mid and long term, it's really positive. Nobody, of course, wishes that to be the trigger for the acceleration in the adoption. So don't understand me wrong. We are all literally praying that this will be over soon. But with a short-term disruption, the long-term outlook is extremely good for any digital health company.
For sure. Yeah, I wanted to ask you a little bit more about that kind of trend of, postponing medical care. Obviously it was a huge financial hit to providers. I'm curious what you've seen on the consumer front. When either sending these bills and kind of these services, what kind of trends have you observed from a consumer perspective of, have you seen costs been going down for consumers? Have you seen folks having hard times paying for those bills at the end of the day?
Yeah, cost down for consumer, no. I can tell you that pretty simple. So a few trends that happen. So the first, you're totally right, elective care is being pushed out. It's very tough to say what is elective care, because there's elective care, let's say you might need at some point a knee replacement. You literally can push that out for a year and you'll be totally fine on that in many cases. And there's kind of elective procedure, which is, I don't know, important cancer screenings, where you say you should not push that out, or you want to do a stress EKG, that is probably not great to push out. You can push that out maybe for weeks, maybe for a few months, but not too long. So that's what we literally have been seeing. So volumes, of course, dropped dramatically when really in March, but then right now, in most of the places in the US, actually, I think for the last 3 months, they are already at pre-pandemic levels. What we have not really seen is a huge rebound effect, so that we are at 120% or so of capacity, which some people thought will happen. I don't think this will happen, because some of the elective procedures also will be canceled for good. That is my feeling. So some of them will be made. There's some pent up demand, but not. On the consumer side, it's actually interesting. So what we have seen, because we're on the payment side, consumers are actually, the propensity to pay is at least as high as it was before. And my feeling is that if you make it simple for the consumer, they actually feel grateful for the healthcare provider. And they all understand in which kind of difficult situations they're and how hard they are working for the entire population. So the morale of the patients in order to pay the bill is actually extremely high. So we were really surprised by that.
Yeah, that is really interesting. I guess, transparency. I always like to know how much I'm paying, even if it stinks to pay that much.
Yeah, it's what in general, people want to pay their bill. I believe in the good of the people. There's no question. Nobody runs out of the restaurant without paying, right? There is a service, you consume the service and you pay for it. However, a healthcare provider very often make it extremely, difficult to understand the bills. And of course, sometimes the prices are completely crazy. So making it realistic, and then all of a sudden people pay.
For sure. And I should have mentioned this at the top, but for everyone in the audience, feel free to drop in questions to our chat. It'd be great to hear from folks and see what kind of questions we want to pose to the panel. I'll get to those in a few. But we've talked a bit about, you three folks as founders and in terms of, as employers with that hat on. We talked about y'all in the context of being healthcare companies. But now I want to shift our attention over to being startups. I think it's been a record year for healthcare investing. By the end of the third quarter, we saw about digital health companies raise a record amount of $9.4 billion, which is, a record over last year. And we haven't even factored in the final quarter of the year. But I was moderating a conversation with healthcare investors yesterday, and they brought up a really interesting concern that a lot of their portfolio companies were kind of raising and baking in funds and doing it now to have the kind of cash and burn rate that they might need to weather this pandemic. Obviously, this isn't going anywhere anytime soon. But it was interesting, especially it was a mix of folks thinking about it from the therapeutic side and the med device side and also the digital health side. But thinking about the three of you, between all of you, you've raised a collective 227 million in our pandemic times. Just counting it up, not a small sum. But Chirag, if I'm not mistaken, your July round was a bit of time in the works. I remember getting coffee back in my office in February, and we were talking, you were here for some meetings and things like that. I'd love to understand what that process was like for you. Obviously, these things take some time and investor meetings kind of carry over. But did you guys have to put the brakes on at any point when investors were like, well, we got to think about our funds a little differently? Or did you have to speed up? Tell me a bit about what those months were like for you.
Yeah, no, it's a really good question. I think fortunately for us, if you remember back to the conversation that we had early on, we were actually able to close it right before the pandemic hit, and everybody kind of the date that Matt was mentioning, March 17th or something. we all were kind of virtual. So we were able to really wrap it up before then. What I will note though is that we did start to see in general some tightness in kind of the ability to, I think everybody just in general felt like, hey, a correction is probably coming. We're not going to, spend our fund to the degree that we might have a couple of years back. So I think we said that, but I think overall we were very fortunate that we somehow timed it just before the pandemic really hit for us to wrap up the thing. So we didn't have to face Zoom meetings to pitch investors and things like that. We were able to do a lot of it in person, luckily, and we had tremendous support from our existing investors too to kind of help prior. So, we were lucky in that sense.
Very, very convenient timing for sure. Yeah, Florian, what was your approach? I know you guys raised around, June or end of May. Any tips on how to nail the Zoom investor meeting?
Yeah, I mean, Chirag, well done on timing. We did not fetch that well. So we literally went out, I would say, in the absolute worst timing for fundraising. So it was, I think we went out in probably April, end of April, when literally everything was completely closed. So the interesting process and I think the observation, and of course in hindsight everything is fine. I do not want to go through that again, but I think a few interesting observations. I think the first is you pretty much feel immediately which funds are open for business and which funds say they're open for business but they are not. What we have seen actually, which was really interesting, funds that have a very long-term horizon of thinking, they literally don't care about the short term. And we partnered then, or ended up partnering with Andreessen Horowitz. They have gone through these crises again and again, right? 2000, they have been operators. 2008, 2009, of course, that's literally when they launched their fund. So they know about this. So they don't think at all what happens this year or next year. They invest right now for what happens in 5 years. And the only question they're asking is what happens right now, is that good or bad for the next 5 years? And that was actually really impressive. So you saw some less, I would say, experienced investors. They literally said, oh, I want a Corona discount. And investors that really have the long-term vision, they do not believe that this has any long-term impact. So I think that's one thing. Then, of course, comes you cannot meet them in person. So, I mean, funny anecdote, I've never met the person who joined our board in person. I think that, or I have the feeling I know him extremely well because we have weekly conversations and we really got both very, very comfortable with each other. And he is absolutely fantastic to work with. Scott Cooper is his name, but we've never met in person. So we started, of course, with Zoom meetings, and you know what? It works actually totally fine. There's no reason why it should not work. All the I would say the analytical things you can do over Zoom anyway. Going through the deal pipeline, going through financials, going through strategy, totally fine to do on Zoom. I think the only thing that is literally lacking is, okay, what is the culture of the business? And does the investor believe that this is the winning team with the winning culture? That is a little bit tougher because it's easy. You go into an office, and very likely, and Lydia, I mean, you have been to many startups offices. You probably know even after 5 minutes, okay, does that seem like a winning team or more like a so-so culture? I'm pretty sure that you figure that out pretty soon, and investors as well. So that is tougher, I think, to get convinced. But it still, of course, is totally possible to do that. You just need to set up a few more conversations with more team members. And in today's time, especially when you go into a growth round, everybody knows a lot of people. So I mean, our investors, they probably talk to at least 10 references of people I've worked with in the past, people I might know, people I actually didn't know that they know me for feedback. And that, of course, helps a lot to gain trust. So overall, I would say it takes a little bit longer, but it's totally fine to do remote.
Yeah, that's interesting. How steep is a coronavirus discount?
I didn't ask for it because I basically said that there is, I don't think that you will get at any time a cheaper in a good company, because I think what happened basically in Corona, and we see that right now as well, there's actually more money available for good companies because a lot of industries are not investable anymore. So I think that is the interesting. So I think right now it's probably for the companies that benefit from Corona a much better time to raise money than pre-COVID.
That's interesting. Matt, how about you? How are your Zoom pitching skills going?
Well, we were very fortunate to have a lead investor in a company called Flare Capital, who we agreed to terms at I think we got the first tranche in like the end of February, beginning first week in March. So that was good timing, similar to Chirag. But we also added other investors as well, and we were really happy to be partnered with them. And the thing I actually thought was awesome about Zoom pitching is that the investor time is an essential part of being a CEO, founder of a business, but it takes so much time. And you're traveling all over the place and you're meeting people in person, and that used to be a thing, you have to meet somebody in person, right? Before they put money in, basically. There are some exceptions to that, but for the most part, some in-person meetings. This way cut down on that time. So I thought that was awesome, actually, as part of it. I didn't need to go out to Silicon Valley. I didn't need to go to whatever. I'm based in New York, Boston, or Chicago, or other markets. I could just do some Zooms. So I thought that was actually pretty good. I would also say that, probably, I think I agree actually definitely with Florian that there's just there's a lot of money for growth stage right now. They're trying to figure out where they can put money in. So, maybe we should have raised money, this month instead of back then.
I mean, there's still time. That's gonna be my next question. It's now what? This pandemic's not going anywhere. I'm assuming the vibe I got from some of the investors I was speaking with yesterday is, some meetings are resuming in person, but obviously I don't think any of us are getting on a flight to San Francisco anytime soon. What happens next? Are you guys thinking about what that future looks like of raising again? Florian, now that you've done it once, are you willing to do it again at the very least?
Lydia, do you know how many calls we would get if we said we were raising right now? It would be like a flood of intern emails we'd be getting.
Yeah, I mean, raising money is a necessary evil at some point, right? So we definitely do not think 1 second about raising money at this point. So I think the good news, and it really depends on which kind of business you are in, right? We are in an enterprise software business. So an enterprise software business, usually if the company somehow works and is doing well, doesn't have a problem raising money, but rather a problem to deploy the money very efficiently. It's not very capital intensive. So for us right now, we always in the past have over-raised, so raised more money than we literally need just to have more cushion. So at this point, we do not think 1 second about raising money. I don't think this will happen next year. Maybe 2022 or something, we could consider it, but it always depends. Do you really want to? And we always have one case where we say, if the access to capital is completely blocked, do we have a path into profitability? We always have that case. And the question is, do we want to raise money? Do we have projects where we can efficiently deploy the capital? And there are 2 limiting factors, right? Capital is one, and that's usually for a good company, never the real bottleneck, but it's internal capabilities and capacity of taking on new projects. If I had right now just twice the team size, twice the human horsepower at Cedar, I would love to raise more money. Don't understand me wrong. It's not that I don't that I'm against it. It's just very tough to deploy the capital and scale it. It's not, the limiting factor is definitely not the cash.
Mm-hmm. Chirag, what about you? Now that you've heard what it was like to do it in the pandemic.
Yeah, I'll say this, Lydia, I am not encouraged to raise during a pandemic after Matt and Florian's rave reviews of doing so. But, jokes aside, I think
5 stars. Pandemic.
No, but I think we just announced the Series B, so we're good for now. I think what Florian said, and the difference, of course, in enterprise SaaS and our business is that we're extremely capital intensive, and there is a rollout strategy that requires physical infrastructure, and so obviously being able to do that in an effective manner requires money. And that's why we raised the money that we did, given the success we've had in our existing market. So we don't have any, urge to go and raise more money right now or necessity, but I agreed with what Florian was saying, which is at the end of the day, I think if you stick to the plan that you've set out for and you're solving a real need, you're able to get money, right? The issue is less about access and more, is that the right thing for you to be doing at this moment? And I think for us, it's really about how can we scale this to other markets?
Sure. Yeah, and on that point, I want to get to a couple of questions from the audience. There was one that came in for you about Medly. And obviously, we were chatting in February and expansion was kind of on the horizon. How did you guys make the decision to double down on that and you decide to grow into new markets during a pandemic? I'm sure that wasn't an easy decision to say yes to. How did that kind of shake out?
Yeah, no, it definitely was not what I envisioned, but I think it kind of goes back to what we had decided as a business, that for this to really be successful and I think to really make a dent and create a pharmacy that impacts a wide variety of patients, we require physical infrastructure. So since then we've opened up 2 more markets, Baltimore and Miami, and we're looking to announce several more towards the end of the year. And it's again been a little atypical because there's obviously quarantine when you leave the city and setting up the physical infrastructure, but the approach really hasn't been terribly different than New York. Of course, we have a consumer side of the business, so there's your typical direct to consumer marketing that we're still doing. Of course, the types of marketing might be changed, right? But still the approach is the same. We're still working very closely with providers, right? And that's been a big focus for us. So from that standpoint, things are not terribly different. Of course, the circumstances in doing so are.
Sure, for sure. Yeah, and another question, just not much of a great transition here, but a question this time for you, Matt. You mentioned that you're kind of serving in this really broad healthcare role for a lot of folks, and a lot of folks are taking this a lot more seriously. You're talking to CEOs, you're talking to teams you might not have interfaced with before. It used to be HR departments. What I guess priorities do they have for you as, and is it different than maybe the HR team? Do they want you to be really doubling down on virtual care, and I guess how is that impacting how you guys operate?
Yeah, it's an interesting question. The thing that I think is a common through line is that they're all trying to understand how their business best operates at this time, right? There's a certain group, and I think manufacturing is a really easy example where it's kind of obvious, right, how they need to interact at this time. They need people on the line. They need people doing a set of things that are pretty clear. So for them, it's while it can be complicated and they really need to be taking the health seriously of people, they kind of know their direction. I think it's very different when it comes to the cultural components of working well, right? And employers who are trying to figure and sort that out. That is a sort of a different process. And so, so that is kind of another component. And I would say as well that this is happening. There's I kind of think about it in breaking out in sort of 3 distinct groups in terms of population. There's the must be on site group. There is the it would be better if they were on site group. And then it would be these folks can work from home effectively. But everyone's part of the company, right? And everybody's contributing to the growth of that organization. So you have to actually deal with them separately. So I don't have a good example of being every company really wants to figure this thing out versus that thing out. They're all trying to weigh what makes sense for them and deploy something in a way that's comprehensible for them. I think that one of the many things that's been really tragic about the pandemic has been the inability of governmental organizations in the country to give guidelines to people. Every company is deciding this for themselves, which is just so mind-boggling that each company has to be an epidemiologist, an expert in law, right? Like a logistics coordinator, and they're all doing it differently. And so, I mean, people are really ingenious in many ways and can figure out how to make it happen. But the fact that this isn't more coordinated is just, I think, really disappointing in many ways. So we've played that role for companies, but it's been a lot of thought partnership for sure.
Yeah, you're involved in the biggest question of our time of, what level of remote work is accessible or doable on any given day. It's not an easy one to answer as far as I can tell.
We're here to help. So just give me a call. Put the number at the bottom of the screen.
There you go. There you go. I myself am totally taking advantage of the remote work life. I'm going to pack my bags and leave New York City as much as I'm going to miss this apartment. It's worthwhile to go spend some time in the mountains.
I think you'll be back. That's my guess. I think you'll be back.
We'll see. We'll see. And another question that came in at Florian, I think this would be a great one for you to kind of tackle first, but everyone feel free to weigh in. It seems like, and we talked a little bit about how themes have kind of really accelerated in the pandemic. People are, more willing to adopt new models than they might have been in the past. They're willing to take on telemedicine, all that great stuff. And we talked about how financially hit providers are getting, and it seems like a lot of that is tied to the typical fee-for-service models and things like that. Has it prompted you guys as an organization to do any level of soul searching or, really thinking hard about what Cedar does as an organization that can be a part of the future of healthcare? No small topic right there.
Yeah, actually, I think our business model and the problem that we try to solve, right, is to engage the patient and be the connection between the patient and the healthcare system. And that problem existed when we started the company 4.5 years ago, and still exists as much as before. There's no question. I strongly believe that this is something that actually will get more and more important, and has nothing to do with COVID, has nothing to do with any political party. It just has to do with what do consumers want. And I think there's this interesting saying, right, that your best experience anywhere becomes your expectations everywhere. So what does that mean? If you go right now and can shop for your flight easily online, pay digitally on your phone, you watch your Netflix movie on your phone or download it and have a personalized queue on what to watch next, shop anything on Amazon, and then you go to the healthcare provider and you might still need to, fax a copy of your insurance card. You might still get a stack of paper that you don't understand. Doesn't make any sense, right? So this has been in the past. We still absolutely fulfill that. There are a few things I think very, very interesting going forward that even have bipartisan support, which are very few things, but things that just is impossible to ignore, which is, for example, price transparency. Everybody agrees that there should be transparent pricing because price is one big part of healthcare. You cannot ignore price. It's just impossible. So having a transparency there. Second, that balance billing is not good for anyone. Everybody tries to somehow blame somebody else, but the patients are suffering from that, and this needs to be fixed. We at Cedar 100% agree with that, and we are working on products, of course, on how to mitigate all of this. But in the end, everything is geared towards helping the patient navigating through the administrative process of the healthcare visit, because they should be able to focus on the most important thing, which is getting healthy again, because it's one of the very difficult phases of the life, and we want to take away all of this administrative. So nothing really changed on this macro perspective. On the smaller feature micro level, maybe yes, but nothing huge.
Yeah, that's interesting. And we've got some price transparency legislation taking out, or policy at least, taking out in the next couple of weeks, right? It's like the beginning of November that some of those rules get put in place.
Yes.
That should be fun. A fun week for sure.
Absolutely.
Great. And then, another question, and I think this gets a lot to your point, Matt, about, what we lose when we're not doing things in person. Who isn't benefiting from the move to, more digital health services? it probably isn't an equitable distribution of everyone is doing great with a 10-minute doctor chat in the way that I might.
Yeah, I think that is really important. The benefit to behavioral, digital health, well, behavioral health, but digital health is extraordinarily inequitable in terms of how it's distributed. It has to do with a lot of reasons. One of them is, how is healthcare financed, right? So you look at Medicaid, there's been some strides during the pandemic, but it's not really supportive of of providers being able to provide services. The payment models don't exist well, and providing virtual care services, it's really difficult to get compensated in the right way. In many ways, because of this system that we have, where it's so inflexible in many ways, and so divorced from how people actually live their lives, and it's more about how providers and systems operate themselves than about where the patient's located and what's best for them. It's really why we've targeted employers, right? Employers have people of a huge diversity of incomes and backgrounds and what have you. You've got millions and millions of people who are on Medicaid or are employed, right, full time as well. And so I think that group is what's allowed us to have something that's more accessible. But I think this is a huge issue that we need to confront, and is going to be very, very problematic as people, we were talking about putting off preventative measures. I mean, the populations that are vulnerable are people who are putting that off in a disproportionate amount. So yeah, I wish I had a more upbeat message on this, but I really don't.
No, but it's a great point. I often think about that. We see so many services that are great for employers or great for the Medicare Advantage group and things like that. But, who's building the Eden for the Medicaid population?
Well, I think over time, Eden's building that, but it can never come fast enough. I think the hard thing is we can't really throw it on, right, like startups to fix all of these problems. I think that many of us are in this, especially in healthcare space, because we would love to, but you have to have the system that actually works and supports it. So, when you're paying behavioral health providers like $50 for a visit for Medicaid, and there's limitations on where they can provide care virtually, but they could be getting $250 if they're taking self-pay. I mean, what is the system doing to promote that in any way, shape, or form? And the reality is that it's not. And so we need to fundamentally redo how things are offered. And look at Medicare. I mean, it's the most advanced payment system out there right now. And so they're really leading the way. So we know it's possible. It's disappointing that it's not happening.
Definitely. This is another great question. Thanks again for sending in all your questions, guys. We've got about 5 minutes left. So if you have any last minute thoughts, get them in now so I can make sure I ask before time runs out. But I really like this one, and I was going to ask it myself too. How do you guys stay calm in a moment like this? You've got a lot on your plates. We talked about it. A lot of hats you guys are wearing. How do you manage it all? Chirag, let's start with you.
Yeah, it's a really good question, but I think it's important, especially as you mentioned during this time. I think creating forums or systems so that team members can really connect at a human level with people in whatever way they think is best, I think is first and foremost. Whether that's holding space for them, giving them the opportunity to connect on their own time, happy hours, bring recordings of the zoo, as Florian mentioned. I think those are all ways of doing that, right? I think that's the first. I think personally, I've been a meditator for about 7 years, and that continues to be something I practice. I have a meditation chair right next to my desk. So, whenever, I'm feeling overwhelmed or I feel like things are out of my control, or, I just need a break, I'll just go sit for a few minutes. And I think that process alone has been phenomenal to just help me reset, mentally. And even as simple as, this may sound very simple, but just going out for a walk and getting fresh air during 7 million Zoom meetings, can be sometimes the most effective tool to help your mind reset and shift and get back to the task at hand. So that's what I do.
Agreed. I'll be on my way out for a walk probably after this call. Florian, how about you? How do you stay calm amidst the chaos?
Yeah, thanks for the assumption that I stay calm, but yeah, I think that, I mean, everybody needs to understand what basically are the trigger points where you as a leader are very sensitive to, and what are ways to calm you down. And I think for me, the most important thing is to literally very rationally understand what is in your control and what is not in your control. And I literally try to completely ignore the things that are not in my control, because I just basically say, I give the best whatever I can. I'm the most prepared for the company, and that's the only thing I can. And that's already, I think, half of the worry is probably gone. And then, of course, you need to find out what are your as Chirag mentioned, what are your life hacks and I'm a runner. I love to run. So every morning I go for an hour run. I just need this, but I did that also pre-pandemic already. So nothing changed on that. I think I can maybe share one thing that I did, which was not good at all, and I will not do that again, is after the fundraise and after the announcement, I went on vacation. And I basically said, okay, let's do 1 or 2 Zooms. It's totally fine. It won't kill you if you do an hour a day. And it completely kills the vacation. Very clear thing. There's no question. So I know that this 1 hour that you need to align your time to the entire day you're thinking about this 1 hour. It's extremely costly, and it was a huge mistake. So I will never make that again.
Fair enough. I make sure I delete Slack off my phone the days I go on vacation. Only way to do it.
I'm not that far yet.
Okay. Matt, how about you?
Yeah. Well, I was saying, looking at the panel, I feel like Chirag and Florian exude a lot more calm than I've been exuding on the panel. So I think it's great that you went to them first. I mean, for me, I think that a few things. One is, as a leader of an organization, your mood really affects people. And so if you are frantic and worried, if you are upbeat, if whatever that might be, it starts to set the tone in almost sort of a subconscious way. So reflecting on that and knowing what your impact is, which may kind of not always be obvious, and then having people who tell you as well, it's helpful. So I think that's important and is just a bit centering. Otherwise, for me, the difference between having worked out in a day and not worked out in a day is totally different. So I do try to make sure to kind of have those practices. And then, I just want to echo the vacation point. Taking time away from work, I think, is really important, and connecting to things that aren't that life can go on as well, just outside of that, I think is so important. So
how long did it take to kind of get to that point, though? Thinking about the early months of the pandemic, were you on 24/7, you guys? Was it just chaos?
I don't think it's gotten that much less chaotic. I mean, early on it was different. It was very, very, very strange, but it's still intense.
I think the big difference is right now that we know this will definitely stay for another few quarters. And when the pandemic hit, literally, I had no idea whether this is right now for 4 weeks or for 4 years. We had no idea. And that's the big difference. So right now we can plan much better and do more, medium, long-term projects.
Yeah, absolutely. Well, great. Well, I know we're hitting our time, so I wanted to thank you guys all for the nice, candid conversation. It was great to chat. Thanks for taking the time, and thanks everyone for tuning in. It was great to get your questions and chat all about, how to pandemic-proof your startup. Seems like an impossible task still.
Thanks a lot, and enjoy your walk, Lydia.
Thanks.
Thanks, everyone.
Yeah, seriously. That was a lot of fun. Thanks.